Yeah, welcome back. We're still trying to set up our equipment. Okay, this is Gateway 101. So, in today's broadcast, we're going to be talking a whole lot of issues. Okay, it's related to your health. Okay, so remember that in Gateway 101, we places emphasis on prevention because we strongly believe that prevention is better than cure. So we encourage you to make sure your immunization is up to date, especially the children. And we also encourage you to make sure you keep up with your doctor's appointments. And we also say that anyone who is our community that doesn't have a means of going for his or her doctor's appointment, we do provide free ride. Okay? All you need to do is to make us know on time and we'll make it happen. Okay? So, without wasting much of our time, we're going to be really talking about things. And remember, we talked about prostate. Remember, we talk about uh, prostate enlargement. We explain how prostate enlargement is diagnosed or the best treatment option based on age and symptoms. Remember, we talked all that this morning, and we also said that today we're going to be we're going to repeat it again because most people were not around when we were talking about it in the day. So we're going to be talking more and more about prostate enlargement. Okay, so what if please kindly subscribe to Gateway 101, kindly subscribe, like and share, like and share, subscribe to Gateway 101. We're talking about prostate enlargement, also known as BPH. It's a common condition. It's a common condition where the prostate gland grew bigger as a man gets older. The prostate is a small gland located below the bladder and it surrounds the urethra, the tube that carry the urethra is the tube that carry urine out of the body. So the prostate is it surrounds the urethra. So the prostate surrounds the tube that carry urine out of the body. Okay, so when the prostate enlarge, it can press on the urethra. Do not forget that the urethra, do not forget that the bladder, it's, do not forget that the prostate is a small gland located below the bladder and it surrounds the urethra. So when the prostate get enlarged, it presses on the urethra and causes urinary problems. Okay, so we heard of a large prostate, a large prostate is different from prostate cancer. Okay, BPH is not a prostate cancer, is a prostate enlargement. So let's get that straight up. Okay, so when the prostate enlarge, it can press on the urethra because it surrounds the urethra and therefore causing so many urinary problems. Okay, so what causes prostate enlargement? So let's take a look at that. What causes prostate enlargement? I would say that prostate enlargement is usually caused by normal aging. As people get older, as men get older, please kindly subscribe and like the channel. Please kindly subscribe and like the channel. This is Gateway 101. So we are saying that prostate enlargement is usually caused by normal aging and hormonal changes. It is not a cancer. It becomes more common after the age of 40 to 50, and many men develop some degree of BPH or a large prostate later in life. Okay, so the common symptoms of prostate enlargement will be a large prostate may merely affect urination, such as frequent urination, especially at night, difficulty starting urine, and difficulty stopping urine. Okay, these are some of the common symptoms of prostate enlargement. It also is associated with a weak or slow urine stream. So, in other words, your urine doesn't come out forcefully. Okay, so it your urine become weak when you try to urinate. That's some of the common symptoms of prostate enlargement. Okay, you feeling that the bladder does not empty fully. So you have gone to urinate, but you still feel that the bladder is full. These are some of the symptoms of prostate enlargement. Okay, sudden strong urge to urinate. You always have this strong urge to urinate. So those are some of the symptoms of prostate enlargement, where you have this strong urge to urinate. You have this strong urge to urinate. Those are some of the symptoms of prostate enlargement. Then you have a dribbling after urination. In other words, you leaking, your urine leaks, so your underwear will be have some scanty urine after you've urinated. It's as a result of prostate enlargement. Is prostate enlargement cancer? No. Prostate enlargement, also known as BPH, is not a cancer. Okay, BPH is not cancer and it does not directly lead to cancer. However, the symptom can be similar, so medical evaluation is important. Okay, why the symptoms can be similar? The symptom of prostate cancer and prostate enlargement can be similar. Um, it takes medical evaluation or medical screening to be able to differentiate. Okay, so when do you supposed to see a doctor urgently? So we encourage you to seek medical attention quickly if you have inability to urinate at all. You cannot urinate. Please seek medical attention ASAP. If you cannot urinate at all, okay, inability to urinate at all is a medical emergency. Blood in urine. If you have this bloody urine is also a symptoms that you need to seek. It's a sign that you need to seek medical attention immediately. Or you have blood in your semen after you ejaculate, you need to seek medical help immediately. If you have severe pain in your lower abdomen, it may possibly be prostate cancer that have spread, or prostate urine that is enlarged. Because don't forget that the gland is surrounded by it surrounds the urethra. So when it enlarges, it presses on the urethra. So if you have pain, your lower abdomen that persistent and refuse to subside even with some remedy, please seek medical help immediately. Also, if you have fever with urinary symptoms, you need to seek medical help immediately. So, what are the treatment options for prostate enlargement? Treatment depends on severity and also age and also medical condition of the patient. So, lifestyle change can be effective for uh, less caffeine, alcohol, avoid drinking late at night. Lifestyle change can be of great benefit, but it also depends on the severity of the prostate. Okay, medication to relax or shrink the prostate it can also be prescribed. Procedure or surgery, which is always the last resort, it can also be used to remove the prostate in severe cases. Okay, so we're gonna go back again and we're gonna go back again and talks about we'll recap. Let me put it that way. We will recap for the benefit of those who are just joining us. We will recap. Okay, so we started by saying that prostate enlargement, also called Bingley prostatic hyperplasia, BPH, is a common condition where the prostate gland grow bigger as a man get older. We also said that the prostate is a small gland located below the bladder and is surround the urethra. So the tube that carry urine out of the body. So when the prostate is enlarged, it can press on the urethra and causes urinary problems. We also said that what causes prostate enlargement? I would say that prostate enlargement is usually caused by normal aging. So as people get older, the prostate become weak and enlarged. Okay, so as people age, it can be caused by normal aging and hormonal changes. It's not a cancer. It become more common after age 40 to 50, and many men develop some degree of prostate enlargement even later in life. Okay, so it become more common as you grow older. Okay, so what are the common symptoms of prostate enlargement? I would say that enlarged prostate mainly affects urination, such as frequent urination, especially at night, difficulty starting urination, or difficulty stopping urination. If you have a large prostate, when after urination, you see that even though you try to stop, you still have this urine dripping from your penis. So you try to stop it, but it's still dripping. So I would say you are leaking. Okay, so those are common symptoms of prostate enlargement. So you have weak or slow urine steam. So your urine is not forceful, very weak. Those are common symptoms of prostate enlargement. Feeling that the bladder does not empty fully, even though you urinated, you still feel that you have a lot of urine in your bladder. You still feel your bladder still press you. Okay, you see, you still feel place, and you want to go and urinate. So sometimes you go and urinate, you just can't urine that comes out. This is a result of prostate enlargement. So you feeling that so this strong urge to urinate, even though you urinated, you still have this strong urge to urinate. Then dribbling after urinating, you still have leaking, you have urine leaking on your underwear. Or those symptoms of urinary tract infection. Okay, so what is prostate enlargement cancer? The answer is no, it is not a cancer. BPH is not prostate cancer and it does not directly lead to cancer. However, the symptom can be similar, so medical evaluation is important. So when to see a doctor urgently. So we say that seek care quickly if you have inability to urinate at all. So this is a medical emergency. Urine in your blood is also a medical emergency. Severe pain in your lower abdomen. This is also a medical emergency. Fever with urinary symptom. This is also medical emergency. Okay, so treatment depends on severity, like we said. I would say that lifestyle changes, less caffeine, less alcohol, avoid drinking late at night, medication to relax or shrink the prostate, procedure or surgery in a severe cases might be recommended. Okay, this is Gateway 101. So let us talk about prostate enlargement diagnosis. Prostate enlargement diagnosis. So we said that um, bigly prostatic hyperplasia, or also commonly known as a BPH, is extreme common as men get older. And the good news is it is very treatable. So never be scared of prostate enlargement. If your loved one do have one, it is very treatable. The best treatment really depends on age, symptoms, severity, prostate size, and overall health of the patient. Okay. So, how is prostate enlargement diagnosed? Doctor diagnose BPH by combining symptoms, physical exam, and a few sample tests. So, please do not forget to subscribe to Gateway 101. Subscribe, share, and like. Subscribe, share, and like. Okay. Symptoms review. Most important first step. The doctor will usually ask about urinary symptoms such as weak urine, steam, difficulty stopping urination, difficulty stopping urination, uh, urgent or sudden need to go, feeling the bladder does not empty fully. These are some of the things. It's the first step, most important first step review that the doctor want to know if you answer yes to all these questions. So a common tool is the IPSS questionnaire, which scores symptoms as mild up 0 to 7, moderate 8 to 9, and then severe will be 20 to 35. So digital rectal exam is one of the tests that the doctor will want to carry on a prostate patient. The doctor check the prostate by inserting a glove finger into the anus to feel size, shape, and firmness of the prostate. So BPH feel large but is smooth. PSA blood test, prostate specific antigen can also be ordered. Actually, is the most popular because it helps rule out prostate cancer or inflammation. Mainly elevated PSA can happen in or with BPH. High PSA need further evaluation. Okay, so high PSA will need a further evaluation. So urinalysis, check for infection, check for blood in the urine, check for kidney problem. Urine flow test, uroflowmeter, measure how fast urine comes out. Low flow, so suggest blockage from a large prostate. So 6, post avoid residual test, PVR. Post residual test ultrasound, check one, much urine stays in the bladder after peeing. High residual mean incomplete empty. So sometimes we do the prostate ultrasound if needed, used to estimate prostate size before surgery or advanced therapy. Cystoscopy, all urodynamic tests only for complex cases. Okay, so when symptoms are severe or diagnosis is unclear, so this um, higher method of testing may be applied. So bed treatment option based on age and symptom. Treatment is personalized. Not every man needs surgery. So my system usually any age. Best option will be wash full waiting. So we're looking at lifestyle change. If symptoms are mild and not affecting quality of life, lifestyle change is important because it reduces evening flow, limit caffeine and alcohol, avoid congestant because it can worsen blockage, trim urination. It can also worsen blockage. So time urination every 2 to 4 hours. This will help you so that you don't go peeing yourself. And maintain healthy health and activity. So this is Gateway 101. Okay, so we talked so much today already, and do not forget we treated the same topic this morning, and many of you were saying that you were not available at that time, so you want a new topic to be treated, but we decided to go through the prostate enlargement because of the volume that we received. There were so many people who were calling for this lecture to be rebroadcast again. Okay, so like I said, uh, this is Gateway 101, and we appreciate you all for tuning in. But please, please, please do not forget to subscribe. Very, very important. Do not forget to subscribe to my channel at Gateway 101. Thank you so much and stay blessed. Bye for now.